Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Zolmitriptan. Its brand name is Zomig. And before we talk about the medication itself, just keep in mind that this channel is for informational purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Zolmitriptan works. We'll then discuss indications, or reasons we would prescribe this medication to a patient, followed by contraindications, or reasons we would not be able to prescribe Zolmitriptan. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Zolmitriptan work? Well, Zolmitriptan has highly selective agonist activity at 5-HT1D and 5-HT1B receptors. It constricts cerebral blood vessels, which reduce the pulsation that may be responsible for the pain of vascular headaches. Now, in terms of indications or reasons we would prescribe this medication to a patient, we often see it used to treat acute migraines. With respect to contraindications or reasons we would not be able to prescribe Zolmitriptan, we wouldn't be able to give it to a patient who had coronary artery vasospasm, as well as patients who have a history of stroke or transient ischemic attack, or TIA. Patients with uncontrolled hypertension or high blood pressure would not be able to use this medication, as well as patients with ischemic bowel disease. This medication is not to be used within 14 days of a monoamine oxidase inhibitor, and it shouldn't be used to treat hemiplegic or basilar migraines. Patients with significant cardiovascular disease should not use this medication, as well as patients who have ischemic coronary artery disease. Now, what about dosing with Zolmitriptan? So in the treatment of an acute migraine, if somebody was using the oral tablets, the initial dose would be 1.25 to 2.5 milligrams orally. They may repeat this dose after 2 hours if needed, and the maximum dose would be 5 milligrams per dose, and the maximum dose per day would be 10 milligrams per day. If they're using the orally disintegrating tablets, they may use 2.5 milligrams orally, and again, they may repeat the dose after 2 hours if needed, and the maximum doses would be the same, 5 milligrams per dose, 10 milligrams per day. For the nasal spray, they would use 2.5 milligrams intranasally in one nostril. And again, they can repeat the dose after 2 hours if needed. Max dose, 5 milligrams per dose, 10 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Zolmitriptan, so I'll go over some of those here now. Nausea may happen 4 to 9% of the time, and 17 to 21% of patients using the nasal spray may experience an altered taste. Xerostomia may happen 3 to 5% of the time, and asthenia, or abnormal weakness, would happen 3 to 9% of the time. 6 to 10% of patients may experience dizziness, and 5 to 10% may experience paresthesia, which would be a burning or prickling sensation that is usually felt in the hands, arms, legs, or feet, but can also occur in other parts of the body. Some patients may experience a hot and cold sensation. This seems to happen 5 to 7% of the time, and 5 to 8% of patients may experience somnolence. Some patients may also experience a pain in the throat. Now, some more rare but serious side effects would be a cerebrovascular accident or unexplained vision loss. That's all we're going to talk about today with Zolmitriptan, or Zomig. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found this information valuable and you'd like to help grow the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.